Hello, I'm Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and today we're going to spend some time talking about illness in cats. There are a number of illnesses that I see commonly in practice in my feline patients. So in no specific order, I would say dental disease, infectious disease such as feline leukemia and FIV, kidney disease, hyperthyroidism, parasites, and GI disease, pancreatitis and/or inflammatory bowel disease. And also, to round out that list, probably cancer and diabetes. Well, cats are actually very adept at hiding illness, and they have done so from the beginning of time. So if your cat is sick, you may not notice obvious signs like you would in a dog. In cats, it's far more subtle. The cat becomes less visible. Oftentimes, one of the biggest signs that your cat is ill is that they will begin hiding or hide in the home. They can have changes in appetite. Either they just stop eating or they're eating less over the course of time. Perhaps changes in water consumption and urinary habits, litter box habits. That's a really big one. If you notice that when you go to clean your litter box, the litter box is getting dirty a lot faster in between the periods of time when you scoop the box, and or just that the urine balls that you're seeing in the litter box are very large. Those are very good signs that there is something wrong with your cat. Disease can actually be what we'd consider a silent killer in cats. Many cats that have underlying heart disease walk around their homes clinically normal. Owners will not report that there is any problem at all, and sometimes in those cases the only report of a problem is sudden death. The cat literally just keels over dead. If we have a chance to pick up on signs of heart disease in a cat prior to the onset of sudden death, oftentimes the clinical signs that owners will report will be things such as poor energy, lack of energy, or what we would call lethargy. Again, hiding, sometimes coughing, and or breathing problems. Either the cat at rest has a very, very high respiratory rate, and it's not associated with activity or exercise. Signs of dental disease in cats generally include one or more of the following four. Either a change in the cat's disposition towards food itself. Your cat may go to the bowl, like he or she is hungry, and when they get to the bowl, maybe sit there and stare at the food bowl and or eat, but very, very slowly and in smaller amounts than they normally would. Another sign associated with dental disease would be when your cat is eating, you may notice, if you pay close attention, that your cat kind of cocks her head to one side or the other, preferentially chewing on one side of the mouth. The third thing that I commonly hear about is drooling. Cats who are having mouth pain due to dental disease oftentimes will drool, even at times when they're not necessarily eating, but certainly in the context of when they're trying to eat. They may not be able to close their mouth completely, and you'll notice drool. And the last clinical sign that is seen would be excessive pawing at the mouth or the face. And I don't mean a typical cleaning after feeding like a cat will do when they wet their paw and then groom their face. I'm talking actually just kind of rubbing at the mouth with the paws. So I think the first thing you'd need to know is what are the clinical signs of parasitic infections in cats? And it's probably one or more of the following. Either your cat is vomiting, and sometimes the vomitus will actually contain worms. They could also be having diarrhea, and similarly, there could also be parasites seen in the stool. And then I think the third sign would be changes in your cat's weight. In other words, a loss of weight despite a good appetite, and or changes in eating approach towards food in general. They may be eating less or eating more. And how are those parasite infections treated? Generally with medication that will be prescribed by your veterinarian that's appropriate to kill that type of parasite. It should be stated there is no one therapeutic deworming medication that is appropriate for killing all types of parasites in cats or dogs for that matter. So this is going to be really important that you get your veterinarian involved. They'll do some parasite screening to determine what the problem is and then prescribe medication for that problem. Feline asthma is a really interesting illness that we see in cats, and it generally has a seasonality to it. We'll see an uptick in cats with feline asthma generally in the spring or the fall. The most common clinical sign that owners will report in cats with feline asthma is coughing. Coughing is something that is rarely seen in cats, and so when your cat is coughing, pay very close attention because that is completely abnormal and is generally a sign of either asthma or can be associated with heart disease and or primary lung disease. But to be clear, coughing is always abnormal in cats. And that is probably the most common clinical sign that I see reported to me by owners when we're working up a case that turns out to be feline asthma. So thanks for spending some time with us. I hope you found this little video informative and answer some questions you may have about your pets. If you have any questions, give us a call at Tuscan Ridge Animal Hospital.